Welcome to the Caretakers, a show where we'll talk about what it means to be a caretaker on Earth. Whether we're intentional about it or not, we're all caretakers. We've been entrusted to take care of our family, our friends, our environment, and ourselves. We'll talk about strategies for taking care of yourself, mentally, physically, and spiritually. We'll talk about what it means to take care of others, from your neighbor across the street to the neighbor across the globe. This is going to be a journey of self-discovery and reflection, and we hope you join us as we strive to be the best caretakers we can be. Today, we're joined by somebody who inspired the Caretakers podcast in the first place. Dr. Adnan is a medical oncologist at Victoria Hospital and the chair and imam at the Muslim Wellness Network. He graduated in medicine from Damascus University in 2012 and has a bachelor in Islamic studies from Durman University in 2011. And when I was thinking about with some of my friends, what do I ask Dr. Adnan? What do I ask Sheikh Adnan? Everybody wants to know more about you personally. They want to know your background. They want to know about you as a child. And so I've heard you say some things that I want to ask you about specifically. Sure. I heard you say, and this is a quote.
Sure.
I could have been professional in ping pong.
Yeah.
Tell me about that.
Yeah, so when I was younger, I was a big football fan. I still am, and I played semi-professionally in a second league team. I was a good left back. I was a very good left back, and I loved that role. And I busted my knees. I'm one of those stories of the classical bad knees, and I've had 3 surgeries in my knees. So at some point, the doctor told me, "Look, you can't play football anymore. So go do something else." So I picked up table tennis, and subhanallah, I ran a Quran program in the village, and we had access to this club. It was the only club, sports club that existed in probably the whole region, and it was empty on the inside. So my friends and I, we bought a table tennis table. I actually got a table and got the stuff and the gear. And the funny thing is, we started playing, and I had a friend of mine, Omar. We played together for a while, and we were getting better. And then we heard, this is actually a true story. So what happened was the Syrian national team brought a Chinese a coach to train them. I don't know what happened, but they fought with him, and he couldn't speak a word of Arabic, this guy, and they ended up he didn't end up coaching them, and he went and he was living maybe 3 kilometers away in a city called Qatana. Because he had come based on recommendation of an old champion, Syrian champion, who was living there. So he stayed with him. So he went over there to see what he's doing, and he wasn't doing anything. He was just hanging out. So we asked him if he would train us. So he trained us for maybe a month and a half. We would go there every day and at night, and we would play for a couple of hours. And he was, you remember ever seen I'm going to sound very old, a Karate Kid?
Yep.
So there was a Mr. Miyachi, I think his name was Miyagi, and he was the thing. So he was like that, and he made us you had to stand a certain way, you had to hold the paddle in a certain way, had to do things. So he was very hard, but we learned from him. We learned from him enough that we started playing, he and I, doubles nationally, and we played nationally a bit, and we won, I think, one tournament nationally. It wasn't on the highest level; it was on the province level. We won one thing, and then we played singles. He actually did better than I did, but I got to the quarterfinal once, on the national level. So we played a little bit. We could have gone farther, but I got caught up with residency and stuff, and we kind of had to stop it. But
right.
I still play. When I find there is a table tennis club here in London that I went and played in for a while, but they're not that great. And of course, I'm much fatter than I was before, so I'm not as good. But I love it's a really fun. It's actually the best cardio you'll ever get. If you're someone who's interested in sports and wants to do cardio, just learn to play table tennis. Honestly, you'll play for an hour, and you'll be. What's Captain America's name? What's that?
Chris Hemsworth?
Yeah, no, Chris something else. Chris Evans. So Chris Evans actually was on I think it was a podcast, but it was on an interview, and mashallah, he's a monster. So they asked him how do you stay so fit? So he said ping pong. So they had to laugh at him, and he's like, no, I'm serious. The cardio is in ping pong, and they actually went and watched him, and he's really really good, mashallah. So that's my ping pong story.
So that's going to be taking care of yourself physically. Pick up a ping pong racket.
I don't do very well anymore, but sure.
Yeah. Okay. I've another thing I heard you say. You talked about the fact that you used to ride motorcycles quite a bit.
Yeah. So in Syria, it's the art of mentoring younger people. So you have to be cool to mentor younger people, especially if you're young. If you're in your 20s, you have to do that. And a lot of people here don't understand that piece. So I, in the Badliya, I always had, there are no cars really. So people use, either they walk, bicycles, or motorcycles. So almost everyone has a motorcycle. But I had like a nice Yamaha. It's not a sports motorcycle, but it's something that I really loved. And I used to use it to go to the masjid. So I had a brown leather jacket, and my hair was long, by the way. It went back in a little bit, not really a full bun, but I had to hold it back with something. So I would ride up to the masjid on a motorcycle, leather jacket, and my hair sent back. So the kids listened to everything I had to say. I'm not that cool person anymore, but that was having a motorcycle is amazing. It's hard here to get an actual license for it, and I don't think it's as feasible. But in villages, it's amazing, especially in places that are warm. So you're kind of riding out in the open. And I absolutely loved it. I hope, inshallah, one day to get a motorcycle back. But Abdurrahman Lawandi, Dr. Lawandi will kill me if I get a motorcycle. Because any orthopedic or spine surgeon will tell you that the worst thing you can do is
buy yourself a motorcycle,
because they see the worst part of it. Like they see what actually happens when you're not careful.
Right. So ride safely.
Exactly. There's a couple of brothers who come here who actually have motorcycles, and they have like beautiful bikes. I'm not sure if you've seen them before, but they're really, really nice bikes.
We'll look out for them then. Yeah. Okay, and then on your last personal note, just the history.
Sure.
I noticed before we even started, you were watching English Premier League.
Yeah, I'm giving up something big for this podcast, so you have to be very, very, very thankful. I've been watching the Premier League since I was maybe 6. Or maybe 5 years old. It's the sport it's my poison, yani, of choice in terms of what I like to watch. But I enjoy football for sure. I'm a big football nut, and I'm actually a little bit embarrassed to talk about how much I know about this sport. I shouldn't know as much as I do. But I'm one of those guys. If you actually get me worked up talking about soccer, I'll go into like long rants with people on certain aspects. So the Premier League is my Saturday, Sunday morning. That's it. Don't talk to me. Don't come into my room unless you're bringing with you some popcorn and something to watch the game with me. Then I'm out of commission for that hour.
And people want to know, who do you support?
I'm a Man United fan. Anyone who's born in the 80s is a Man United fan, because they just had if they're a Premier League supporter, they're Man United. It was the moment Eric Cantona flipped his collar. That's it. I was sold. I actually watched the famous 1999 Champions League final when Man United played Bayern Munich and they won in the last minute. It's one of probably the most famous European club moment in history of the game. And I watched it live. Of course, I wasn't there, but I watched it live, and something that
you hold and you cherish.
Exactly. No, the team sucks now. I've been depressed for 10 years plus since Alex Ferguson left, but still I enjoy watching it. It's fun. And my son, he's born in 2012, so he's a Man City fan, because that's the team he's born into. So I get to have a little bit of a rivalry there.
Right. So you mentioned your son. You're a doctor, mashallah. You are a sheikh. You enjoy ping pong, motorcycles, and Premier League. How do you manage your time? I don't know that I've ever met anybody quite as busy as you are.
I get this question a lot, and I find it really difficult to answer, because I honestly genuinely don't feel that I do too much to manage time. Maybe because I got used to a certain lifestyle when I was younger, that it just kind of comes a little bit more naturally. But I really don't feel that I do anything special. When I was younger, all the shuyukh that I had were very picky when it came to time management. Like, they were very clear on what, they would ask the question a lot, and they would hold you to it, and they would see they would actually ask you exactly what you were doing and go, I should be doing what they did for me. But they were much more strict, and I was much more willing to stick around even if they were. And I find that most of the people I deal with, if I push it a little bit, they just they walk out. Like, it's hard to hold. The strictness piece doesn't work anymore, so you just have to be very patient. I was in it. That was it. Khalas. My dad left me with the sheikh, and that's it. He told me, if he kills you, I don't care. Like, I'll just bury you in the backyard, so no problem. Maybe you should take that off. There's a saying, if you send back a adam, we'll just bury, no problem. So that's what. So I knew that I had no way around it. So whatever they held me to, I had to be held to. Like, I had to do it. So time management was a big piece of it. And it was just scheduling your day, making sure that you're not there's no time in the day that's not accounted for.
Right.
You know what I mean? Like you're not just, even if you're, I take care of my leisure. Like I watch sports. I spend time with my dad and my uncles, and we play cards, and like I enjoy my time. It's all scheduled. Like I know what timing that's going to happen. So I'm not just sitting there. I think people when you don't schedule your time, you're not used to doing it, you end up wasting a lot of it. There's a lot of dead time, like time that's just not accounted for, that you don't do anything for yourself within it. Meaning you're not benefiting, or you're making your life more stressful.
Right.
Like if you're sitting down doing nothing, just scrolling just makes you, it tires your eyes, it tires your brain, it tires your psyche. So you get nothing out of it. You know what I mean? Like you spent an hour. That hour now requires like a couple more hours of rest for it. So it's like, it's taxation. So you have to just get rid of that dead time and utilize the dead time to do good stuff. Like if you're standing in line, if you're driving your car, what are you doing? When you're driving your car, what are you doing? I just Right. And to keep the Quran, you have to do muraja 2-3 juz a day at least, or I should forget it. So when I'm driving, that's when I do the wird. That's if I'm standing in line. Like whenever there's time that's dead, it's really not dead. I'm putting something in it so that I can utilize it, appropriately, so that there's something being taken out of my way. And I have a super wife. Honestly, if it wasn't for my wife, I wouldn't be here. Like she picks up a big aspect of this work. Like if you're married and you have kids, you need someone at home who believes in what you're doing and is willing to support you doing it, and accept that you're not available as often. We don't go places very much. Like
right.
Our travel log is really pathetic. Like we don't if I say the word Niagara in front of my wife, she threatens me with divorce. Like I've taken her there so many times. All of our family memories are somewhere in Niagara Falls. It's like we live there because it's just a 2-hour drive and stuff. But yeah, there's certain sacrifices you have to make. I'm not sure some people maybe aren't. I would say just go back and look at your schedule. Like log your week, not your day. Log a week. Log from like Monday to end of Sunday, and just take a look at it. Don't do anything artificial. The problem is people, when they log their weeks, they start to size themselves up to do better. No, just log a regular week. At the end of the day, just put what you did that day, and then look at it, and then you'll identify like a lot of time that nothing happened that was of benefit to you. And if you just insert some stuff with consistency, you get very far.
Right.
Like with consistency, with maybe 10 minutes a day of reading something. Like I have a habit of reading 10 hadith every day. Every day I read 10 hadith. I used to have a journal where I'd write one of them down that I want to stick with me. But you do that every day for 20 years. You've covered everything. Like you've listened, right. you read all of the hadith that are, I mean, like, and you know them all. And the same thing if you're like, as a physician, if every day I read 10 minutes of worth of abstracts or journals, then I know more than I would have if I didn't.
Right.
Yeah.
That for me was the big difference. When I started managing my time, the thing that made me really start to manage my time is getting married.
Yeah.
And I was working full time and I was writing professional exams.
There you go.
And so for me, the thing that I struggled with the most was guilt.
Yeah.
Is I would be watching TV with my wife and thinking I should be studying. Or I was at work and thinking, I should be studying, or I should be spending time with my wife. Once I started scheduling to say, okay, I'm going to spend time with my wife on Saturday night. That way, when I'm doing that, I know that Sunday morning I'm studying.
Exactly.
And there's no guilt.
Exactly.
And you put everything into
give everything the time that it needs, and just make sure that you respect that time. I schedule leisure also religiously.
Right.
Like as I schedule, obviously the work and prep. There's some degree of prep for work and for the masajid. You have to have some prep and meetings and stuff. So it's all scheduled. So I don't feel, because I know that this is my day. I know what I'm doing in that day. It's actually not. It doesn't. Some people think it's it's restrictive or boring. It actually is not. It's actually very, very refreshing. You feel really good. Like you feel very good if you do it, and you get a lot done. You get a lot done in your day if you do that, and you just have to kind of. Don't sleep too late. Wake up reasonably early. Invest in your personal mindfulness. People who don't meditate or think, engage in deep thought, they end up feeling that there's no barakah in their day because your brain has to think about things. Like it has to internalize concepts. And if you don't give it time to internalize stuff that it heard throughout the day or problems that are occurring, then it's like you're carrying this burden, and that burden that you carry, it's like you're trying to walk. Right, and if you're walking with a couple of extra kilos on you, then you're gonna walk slower. So that burden, that mental burden, you have to remove it. And that requires just time where you're just sitting there doing nothing, just thinking. Like, even that is scheduled. Like just sit down, right? You sit, and I'm just going to, there's a couple of things that are in the back of my mind that I have to deal with. So I sit there and I think about them. And sometimes it's an emotional thought process because there's something that happened that bothered you that you haven't really kind of dealt with on a personal level. It's not a perfect system, but I think it's Yeah, I think it's helpful a lot, and that's the best I can offer. I mean, most people ask this question. I can't really. I don't know what else to say. I mean, alhamdulillah, inshallah. I don't think that I'm doing that great, honestly. But if I say that, people get offended, so I shut up. So I don't say anything. But I don't think that there's anything special. You can probably do better than I am doing if you just schedule your time a little bit, and.
Right. And you mentioned a little bit about sleeping early and waking up early. So I want to ask you about your sleep schedule. I know Ramadan is coming up, and that's
Ramadan
a different beast.
Different. Ramadan is a different it's a story. Ramadan, you walk in accepting that you're going to get less sleep, altogether. And I make it up, make up for the less sleep on the weekends. And then I schedule my time off on Ramadan like in July. Like my time off in April was scheduled in July. People think I'm insane at work, and I go, no. Here's Ramadan. Here's what it's going to be. I do not schedule anything at the end of April because I need those last 10 nights for tahajjud and then you kind of just power through Ramadan. And alhamdulillah, this year inshallah I will have no call. It's honestly for me it's the call. If I'm on call and I'm here in scrubs and then taking pages and then going to the hospital. Like last year I had to right before Fajr I had to leave.
I remember that.
I had to go back to the hospital, so I had to say someone lead, and if someone has a khatira to give, if not, send people home. Okay. There's usually a dars I couldn't give it. I had to go to the hospital. But alhamdulillah, this year inshallah I won't have any call, which is very generous of the people I'm working with to kind of keep my Ramadan schedule open in terms of being on call. It's all about what your standards are in life. I don't know if this is going to be helpful for you now, but it's about standards. Like if you're used to a certain standard, when you make it more difficult, you feel worse. If you hold yourself to a really high standard all the time, then any ease that you get, you feel better about. Like for me, if I'm not on call in Ramadan, I'm happy. Even if I'm sleeping 5 hours a night or 4 hours a night, it's fine because at least I'm not on call. Because that's my standard. The standard is that you keep a difficult standard for yourself because life is based on expectations. If I expect you're going to give me 80 and you give me 70, I'm upset. But if I expected 50, then that 70 sounds really good.
Right.
So expectations make a big difference in our psyche and how we look at things. So most people aren't good at doing that because they expect, unfortunately, this is what I see, they expect a lot from life, from that which surrounds them in life, like the environment and people and what they get, and they expect less from themselves. You just need to turn that table around a little bit. Right. Expect nothing from people around you. Expect a lot from yourself. And suddenly, if you expect 0 from people, if they give you 10, you're like, wow.
Yeah, thumbs up. Yeah.
Barakallah feek. But if I expect 20 or 30, and then I'm not happy. So it's that simple. If you want my advice on it, it's that simple. It's really that simple. You expect more of yourself, suddenly you change. It's a complete shift of mentality altogether. And if you expect nothing from people around you, like if Jazakallah khair, he helped me in something, I am extremely grateful. If I expect from him to be here every time I come in, and one time he's not, then we're not going to be happy. I'm gonna have a problem with him later on. So it's really about expectations that you carry in life, and it'll take you a long way in marriage, with your children, with your employees or employers. The less you expect from people, and the more you expect from yourself, the happier person you end up being. You work harder for sure, but I believe the more you work, the more experience you have. You learn more, you become better at what you do. Like it's all at the end. It helps you at the end. Like if I go in the hospital, I'm expecting to see maybe 5 patients that day, and I end up seeing 7. But if I'm going in, I'm going to see the whole list, and then someone sees 2 or 3 patients, I'm all happy, right? See, I saw more people than others are seeing, and I worked harder, but it's helped me. I saw more patients. I have more experience now. I know more how to do my job better, so I'm actually, you know what I mean? So
Right.
Not everyone sees it that way, but I think that's one of the things that help me in life, and I think if everyone thought about that a little bit, they may find that that would help them as well. Wallahu alam.
Right. Okay, so you mentioned work. Now we're going to get into the portion that I really want to talk to you about. So can you explain what you do? So
oncology, which is the study of the medical study of cancers, right, requires a team of people because cancer is such a difficult disease to treat, and we have obviously we don't have perfect answers or perfect cures for most cancers, if not all of them. So you need a team. You need a surgical surgical oncologist, meaning a surgeon that specializes in removing types of cancers, and it's not one type. Like a urologist has to specialize in taking out urological cancers, and a general surgeon will specialize in taking out GI, the gut type of cancer. So there's a lot of different surgeons. And then when it comes, so there's the surgery. And then you need a radiation oncologist, a physician who will treat cancer with different doses of radiation. And then you need a medical oncologist, which is what I do. You need an internal medicine physician who understands how the body kind of works on the inside, how blood work, what effect cancer has on organs, and how, and then treats cancer with medications, which is what I do. I treat it with medications, whether it's chemotherapy, immunotherapy, targeted therapy, chemotherapy or other types of hormonal treatment, for example. That's what I do. And then you need a oncological pathologist, like a pathologist who actually can get the specimens and look at them through a microscope and diagnose. And you need a radiologist, an oncological radiologist. So a radiologist just reads the scans and tells us whether it's getting worse, it's getting better, if that node is actually cancerous versus not. So you need a team of people. And then you need you need a psychologist, and you need like a social worker, and you need a palliative care team. So oncology is its own division in every single hospital. Like it's its own thing, just like pediatrics is its own thing, just like psychiatry is its own thing. Oncology is its own section in every hospital because it requires a team effort. So I'm just a part of a puzzle, one piece of the puzzle, where I treat cancers with drugs. Usually, 90% of my patients are patients who have cancer that has already spread in their bodies, and it's going to take their lives at some point. And I can just treat with drugs to hopefully, to prolong life as far as we can tell from a biological perspective, and give them good quality as they go through it. That's the majority. We do other stuff. Like I do treat patients who are aiming for cure, but they're aiming for cure by treating them before surgery or right after surgery. But the majority of my patients, my specialty is genitourinary. So I treat prostate cancers, bladder cancers, kidney cancers, and testicular cancer. Those are the four, and then adrenal gland, which is very rare. But those are like the 5 types of cancer. There's a few other smaller stuff, but that's the kind of the main sites that I treat. The majority of my work is with metastatic prostate cancer patients and metastatic kidney cancer patients, meaning they had cancer in the prostate or the kidney, and now, unfortunately, we have spots of that same cancer in parts of their body. Most people think, I have cancer in the bone. Bone cancer is very rare. It's usually a cancer that went to the bone. Just being in the bone doesn't make it that cancer. It's still the initial cancer. It's just in the bone, and then the treatment that we give is still the treatment that we give for that cancer. So that's kind of, in a nutshell, what I do.
And if I could back up a little bit,
yeah.
This may sound like a simple question, but what is cancer?
So cancer, it's interesting. Cancer is basically when your cells undergo some form of mutation for some reason, whether it's environmental, whether it's genetic, whether it's just time, and they stop behaving the way healthy cells behave. Like they stop dying when they should die. They stop responding to what the body wants them to do. Like every cell in your body has a time stamp on it, meaning they have to go through a process called apoptosis, where they just stop existing. They basically die. They kill themselves so that and then all the ingredients are used to build fresh, newer cells, and then that's how we exist. It happens meaning your brain doesn't do that very often. If you did that, then you wouldn't be the way we are today. So, but most of our cells on different levels do that. So when a human cell decides that it's not going to do that, it loses its response to its environment, and it starts behaving in ways that does not respond to the needs of the body. It just starts to grow. And then it's taking up space, it's taking up resources, it starts eating away at other cells, and it just starts basically killing the body. And it's a mutation burden that we're still in the process. We're just skimming the surface of understanding why it's happening and how to slow it down or stop it from actually occurring. So it's the difficulty of treating cancer is because it's you. Like, we can kill viruses and germs and bacteria and stuff because they're not us, but cancer is you. If we're going to kill it, we're trying not to kill you too. We're trying to get rid of it. We don't want to get rid of you too, because actually it's your cells. It's not something foreign to you, which is why the body doesn't see it. Most of the time, your immune system recognizes cancer and keeps it at bay for years, and we don't know that it's there until the immune system, until those cells learn how to camouflage themselves to the immune system, beat the immune system, and then they start growing. And then we come in and try to control it, but at that point, these cells have already learned really over years and years and years and years of fighting with the immune system how to deal with it. Like they've built a resistance to the natural ability to the body to deal with it, if that makes sense.
Yeah. And so is it something that's always been around, or is it relatively recent?
No, for sure. Cancer's been around forever. It's more apparent today because people live longer. Because people live longer, we see it more, and because we have a better medical system, and our medical technology is much. We're able to pick it up earlier, to recognize it, to define it. But historically, going back thousands of years, people would die for reasons that others did not know. They would just get very, very sick and die, and no one would know why. And then they would describe symptoms where they would have ascites, meaning their stomachs would get really big, or they couldn't breathe anymore, or they would have this growth on their legs or on their neck or somewhere, and they would just pass away, and no one knew what it was. And probably one of the earliest, I worked in a hospital called Bayruni in Syria, and Imam al-Bayruni, he's a known Muslim scholar, but he was a botanist, and he was one of the first people who documented this description of what he thought cancer was. And he's the first person to use derivatives of plants to treat cancer.
Interesting.
Which is what most chemotherapy, as horrific as chemotherapy can be sometimes, is extracted from plants. It's taken out of different types of plants and it's used. So he was the first person to kind of really start describing that. It took obviously centuries after that for this to become much more clear, but subhanAllah, the Muslims were able to kind of see and talk about cancer, and there are certain descriptions of Sahaba and how they've passed away that I'm almost certain that there was some type of cancer that killed them, because most people would die from infections back in the day, right? Before antibiotics. That
right.
If you want the surge as a human population, it was when OB-GYN became strong, which is obstetrics, because a lot of people die in birth, women die at birth, and so with children. So once we fixed that piece, and then we got antibiotics, so the population kind of went from a couple of million to a couple of billion within a very short period of time, because we were able to prevent early deaths that can be, Wallahu alam, as every has a dawa for it, except just aging. You end up aging, but you definitely get more cancer the older you get, because your cells aren't as young anymore. They start getting more mutations. They're undergoing so many carcinogens in the environment around them and the food that we eat and just in general. So we just end up having more of it. So almost every person, for example, over 90 has some degree of prostate cancer inside of them.
Interesting.
Almost across the board. If you're 90, you probably have some degree of prostate cancer on the inside, but it's just not diagnosed, or the body was able to contain it, so something else took your life, not that.
Oh. And just in terms of the impact, let's say in Canada specifically, like if we look at a per capita impact of 1,000 people, how many?
It's a good question. I don't actually know the last numbers, but the worse the healthcare system, the more the prevalence of it, the more there's exposure to carcinogens. For example, asbestos was a big problem for a long time. So
right.
That a lot of people got different types of lung cancer and mesothelioma and stuff like that from it. And then paints, lead. Now we're much better at protecting people from the carcinogens that exist within these materials. But many years ago, it was. But the prevalence is still there. Like we're not seeing. Oncology is a very taxing department on any healthcare system. It's probably the most the department that has the most spending in any healthcare system, especially in CAT, is oncology, because the drugs are so expensive. Okay. They're very expensive, and it's so mortal that it's fatal. People will want to try everything that's available to them. It's hard to tell somebody that there's nothing to give you anymore. So we always try to come up with something to help it out. Now there is some corruption there, but that's a different.
Right. And a lot of times you hear stories of people finding out they have cancer. They say, I felt this thing and I went to go see the doctor, and all of a sudden I have cancer. And so how do people find out that they have cancer?
So the problem is that we don't have. So it's a good question. It's a very good question. Actually, it is the question. What is better, to treat cancer or to prevent it? I think that's a simple question with a simple answer. Obviously, preventing its occurrence is way better for the person. It's way better for the healthcare system. It's just better in every way. So the problem is we don't have the perfect tools to screen for cancers, for all cancers. Like this is where I believe more medical and governmental investments should exist. I mean, the money should be put there. I'll tell this to you. I'll tell you this. So when we talk about, if you ever heard like the pharma corruption and whatever, the big pharma and all that stuff, the reason they talk about this in cancer specifically is because so much, sometimes hundreds of millions of dollars put into making a medication that will treat. There'll be a third line treatment for a metastatic spread cancer. Meaning you already have it spread, it's going to kill you. But after you try the first medication and the second one, here's a third one that you made. So like hundreds of millions of dollars we put into finding that medication and then making it available. But a fraction of that money will not be put into figuring out how to screen for that cancer to begin with. So we're still using the same tools. We're still using old tools that aren't very sensitive, that don't pick up. Like, for example, prostate cancer, we have something called the PSA. You probably, if you have a father over 65 or something, their family doctor will run that test. It's not a perfect screening tool, but it's good enough for the majority of cancer. When it goes up a little bit, you can get people in to see a surgeon. They can do a biopsy and look for it. But for a lot of, for example, mammograms have made a huge difference in the survival of breast cancer, because you can pick up something really small, you can take it out before, by the time someone felt something on the inside, it was already into the lymph nodes, and you're trying to catch up with what's happening. Same thing goes for colon cancer. Now we have some tools are a little bit better if we do colonoscopies after a certain age every couple of years. So we're trying to figure that out. But a lot of other cancers, like for example, lung cancer. Some people are like, oh, I'll do a CT scan every year. That doesn't mean we're going to find it. There's always going to be like a spot that's weird in your body. There's weird stuff inside of us all the time, so it's not a perfect. So it's really the screening, piece that's missing today. For an average person, if that's your question.
Yeah, that's exactly my next question. Is like, I've got parents that are starting to age. I want to make sure that they're screening for these things. Yeah. What kind of things should somebody in their early 60s, late 50s start looking at?
So the guidelines are out there. I mean, you just have to be in touch with your family doctor and over a certain age. Meaning if you can afford not to have a family doctor in your 20s and 30s, fine. But in your 50s and 60s, you should have someone, a primary health care provider, so they can actually put you through the system of the screenings that we have. So, which is the big ones that I pointed out for you, which is the PSA for men over a certain age, between 60, basically between sometimes not 59, but 65 to around 79. Like they run it. I think these numbers even change. They change it every year. They're trying to figure out like what the right time to do these tests, because sometimes you get a lot of false positives. Like you get a PSA that's high, and there's nothing in there. But that's a lot of work now.
Right.
The person has to go through a lot of, have to do a biopsy. Biopsies bring the risk of bleeding and infections. And now this person is struggling with all these problems, and he didn't have cancer to begin with. So there's a way the family physician will help with that. They will make sure that you're getting your colonoscopies every couple of years based on your family history. They'll do mammograms for ladies. But outside of that, like if someone's a heavy smoker, a really heavy smoker, then CAT scans for this lung can be helpful. But it really comes down to, I think we do a little bit more communal education on like what to stay away from for cancer. Like we still have a very high prevalence in the Muslim community when it comes to smoking.
Right.
Tobacco, specifically cigarettes, it is for sure. You're going to get cancer. If you're smoking, 100%, if you live long enough, you're going to have a cancer. It's just a matter of how long you live. Like if it's almost impossible that you live. If you'll reach a time where the tobacco the tobacco product will cause some form of cancer. If it's not head and neck, it's lung. If it's not lung, it's blood. Something will happen for sure. So educating people on what to stay away from, and then making sure that once they're of age or they have a family history, that they get the proper screening. But it's not perfect. Right. Like there's no perfect answer to say how to make sure that I'm not going to get it. We're not there yet. Yeah. Right. Which is not maybe not what people want to hear, but that's kind of where we are.
Where we are. And you mentioned smoking. I mean, I think there's been a lot of public education campaigns about smoking, and we have seen rates of smoking going down. But at the same time, we've also seen things like e-cigarettes and vapes increase, and especially in the younger group, whether it's shisha or carcinogens, that kind of thing. So what do you?
So it's we don't have a lot of evidence to support all. We don't. They're not like good. Right. I can encourage people to do it, but it's not. The data that we have is mostly on cigarettes and tobacco. E-cigarettes, we have data that it causes other problems for sure, like in the lungs, in terms of. There's a popcorn lung phenomenon where it causes your lungs to get inflamed, and sometimes like to have a bullae, and it can be very dangerous. Whether it causes cancer or not takes time. Like whenever you introduce something new to the public, it takes time for us to figure out if it's a carcinogen or not, or how much of an effect it has. Like correlating a carcinogen to cancers, it takes like decades upon decades to actually make that correlation. So I don't blame people in the 30s and 20s who smoked, because They probably didn't know. It was more, and you get some nicotine. It's a little bit of a stress relief activity. Some of our shiuch used to do it back in Syria. They didn't know. But now that we have that clarity, I mean, it should be something that is dropped by human beings. When it comes to other aspects like vaping and shisha, I don't know for sure, like whether it is. I'm sure it's not healthy. It's not a good thing. But whether it's a full blast, full blown carcinogen, and that's equal to smoking. Some people like to say that that's worse than smoking. So we don't have that. We don't have that evidence. We just don't. We just don't have that correlation within the medical field. But it's definitely not something that's healthy, and especially if you're young. You don't want to start doing that when you're 20, when your lungs are still technically developing, and if there's a possibility of a carcinogen being within these things, and you're subjecting your body to it early on, then you're giving cancer a head start. You're giving the possibility of mutations to occur inside of you early on, and mutations take time. So if you're going to start at 20, by the time you're 60, you have something that's mutated, and now you have to deal with the fact that it's hard to control it. So it's best for younger people to kind of stay away from these habits altogether. Right. Yeah.
In the interest of some myth busting, potentially.
Yeah.
Microwaving food in plastic containers?
Yeah, we don't really have a lot of evidence to support that. Like, I think there were a few studies that came out. I can't remember. I think some of them were in Europe and one was in Japan, but there's really nothing to support that. Like, there's a bunch of stuff that came out in the late 90s, early 2000s about these things. Now, plastic itself, if it's consumed, is a carcinogen itself. Like plastic itself. I mean, whether you're microwaving something inside of it, whether that causes any problems, we just don't have that evidence. There's a lot of interest there's a lot of marketing benefit when you talk about cancer and how to get rid of it. Like because people are scared of it, and they have the right to be so. Like I don't blame anyone to be. It's a horrible thing to be involved in and to be told that you got. But so people will hold on to stuff like that. Like, don't put your phone beside your bed when you sleep because of the right. That another one.
I was gonna ask you about that one.
And like they always ask me, what about my phone? What's wrong with your phone? Should I put it beside my head at night when I sleep? Like maybe. Just don't stare at it all day long, and you should be okay. Like I don't think that piece is going to make that much of a difference. Maybe it's the time we spend scrolling on our phones is way more detrimental to our health than having it beside your head when you sleep at night. But we just don't have evidence. I'm not saying it is or it is not. It's just medicine is obviously evidence-based discipline. So if you don't have like clear evidence, correlation sometimes can be wrong. If you just make if you just do a retrospective study and you say, here the people who have the cancer, let's see how many of them had their phones beside their heads when they slept.
It's impossible.
All of them. That correlation may not be true because you may have everyone does that, and these people had it for different reasons. So it's not always easy to associate. Correlation doesn't always mean causation or association that's appropriate. So sometimes these studies they lack evidence. They're papers, they're out there, and scientists wrote them. It doesn't mean that it's conclusive. There's a lot of medicine that you have evidence to support that later on turned out to be incorrect. But no, the microwaving. I mean, if you want to be safe, you can stay away from it. Use something. Plastic is not a great thing to overuse for the environment, regardless of anything else. So maybe not microwaving it is a good idea. Using glass or using metal. You can't use metal. don't use metal based on this podcast. Burning your house down.
Right. So in the event of someone getting cancer, if we talk about the treatment that's available to us, you talked about providing medicine in terms of people who are terminally ill. What about before that? If there's anything as a step before you get to that point? Yeah.
So every cancer is different. That's the problem with cancer. There's no cookie cutter answer for cancer in general. I'll try to make this as if oncologists listen to this, they'll be like emailing me. But here's
it's okay to keep it high level. I'll give you that
because so early stage cancers, depending out there, if you catch them early enough, then most of them surgically can be removed. And if they're removed early enough, it's negative margins, there's no cancer on the margins, and there's nothing in the lymph nodes, then you can usually just kind of observe people, and most of the time it works out. The problem is that if the cancer. So the question is always what fueled it. So why is it there? So we found a cancer somewhere, we took it out. So why is it there? Because if you don't fix the problem, then it'll just pop up somewhere else later. Sometimes you can just do that. For example, some skin cancers, just every time they come up, just scrape them off. You can just have like a surgeon or a family doctor, just take them out. Melanomas, if they're really early, you can just take them out and you're good to go. If another one comes up, you just take that one out as well. So some of them you can do that. And others, like breast cancer, sometimes if it's hormonally fueled, then it's not enough just to take it out surgically. You have to give medications to help suppress maybe certain hormones that were fueling it. So every cancer is very distinct, which is the problem with this whole discipline, that it's not as simple as germs and antibiotics, which germ antibiotic, here you give this and you're good. It's not like that. And not all terminal cancers have medications that they can be given, and not all cancers can be removed surgically. So it's very specific to the cancer site, the type of the cancer, meaning the pathology, whether it's an adenocarcinoma, squamous cell, a small cell. What is it? Like what exactly is there? Now we're getting more and more detailed in understanding exactly what receptors exist on these cancer cells, what mutations were driving them. Like certain mutations that if you have in your genetics, then for ladies, if she finds that she has this mutation, then they would actually recommend that after a certain age they remove, they get a hysterectomy or get a mastectomy, even though they have no cancer, because of the percentage. Meaning you're at a higher risk, so high that it's just worth getting rid of the organ altogether. So, and I'm not saying that that's the perfect answer, but this is where we are in terms of trying to figure it out. So it's not. I can't give you an answer that is going to be fulfilling for you. It's just. Right. I always tell patients that the biggest problem with cancer is the uncertainty that surrounds it, is that there's uncertainty. We like to have clear answers. How long can I live? Am I cured? Will I have to deal with this again? And I have to sit there and say, I don't know. Based on the studies I have, here's the curve. Here's the average. Here's what most people go through. But you're not a statistic. You're one person. Allahu A'lam, what side of the curve you lie and what exactly, I don't know. And people don't like that. And I don't blame them. If I was sitting in their position, I would want a clear answer. Like, I want someone to tell me this is how much I have, or you're going to get rid of. Like for bladder cancer, sometimes they come in and we have to decide whether. Now we know that this type of bladder cancer will spread, so we come up with the plan. The plan is going to be we give you chemotherapy up front, and then we take out your bladder, and now you have a bag for urine, which is it's a difficult lifestyle adjustment to make. You know, right. I mean, you have you're a man, and even when you're in bed with your wife, Yanni, you have a bag of urine kind of. It's not nice. Like it's not. I'm not saying that it makes it impossible to live. People actually have a reasonable quality of life with that. But when you think about it, when you're functional elsewhere, right. and you don't feel pain, bladder cancer usually is not that painful. It's just something is you see a little bit of blood, you go do a test, you find most of the time blood is not cancer, but you go, it is. And they do a cystoscopy. They find that it's actually going into the muscle. So far you're fine. But if we leave it within a year and a half, it's going to basically go everywhere and cause problems. So we say, okay, we'll give you chemotherapy and we'll take it out. So what is that going to lead to? Well, you have a probability of 85% of being cured. Right. What does that mean? What does that mean? 85% of being cured. I would recommend it. If it was my father or my brother or me, I would say, yeah, do it, because this is your best chance. I tell you, what I use, the analogy is like, if this is a horse race, I want to put you on the best horse to see if I can get you to the finish line. But I don't know if I will. Like you could do all of that and go through this surgery, and then it pops up somewhere else, and now it's incurable. Now all we can do is just give you medications and see if we can prolong your life for a couple of years without it. But then you're like, well, why did I do that surgery and go through hell? Like, why do I have to go through all of this? And that piece is, I think, the biggest problem with cancer. Inshallah, with time and the more if we learn to, as communities and countries, to invest more of our scientific minds in the study of cancer and the prevention of cancer and the treatment of cancer, and we figure out a better relationship with the big pharma companies. Like these companies run trials and hundreds of millions of dollars to use drugs that treat cancer way down the road. Right? If we can figure out a better relationship where they can make their money and we can still take that away from people, or lessen the occurrence of cancer in the early stages of life. If someone's in their late 80s getting cancer, that's not a good thing. We don't want that for anyone, obviously, but that's different than someone who's 26. Right. I treat sarcomas as another site that I treat, which is bone cancer. And these happen usually in people who are really young. I have patients who are 19 and 18, and they'll live a year and a half tops. It's a devastating thing to hear, but that's kind of where we are. Yeah. Right.
And I want to ask you about that psychological impact on people. I mean, especially when you give somebody that news that, their life expectancy is not expected to be very long.
Yeah.
Kind of, what's their...
I mean, Well, to do what I do, you have to have a certain understanding of the world. Like you have to have a certain a worldview that allows you to accept that this happens and that life is not fair. Allah subhanahu wa ta'ala is. Allah subhanahu wa ta'ala is compassionate and merciful, and a part of being alive is being a part of nature, is undergoing the difficulties and the hardships of nature. And nature can be cruel. And sometimes people who are really young, you have children. I couldn't do it. I actually, okay, when I got into oncology young, like when I was early on, and I couldn't do pediatric oncology. I couldn't do it. Like I spent 2 weeks on a ward, and I had to tap out and say I can't do this. Like it's too hard for me. Kids are my weak spot. You have a 3-4 year old who has brain cancer, is going to die. Like it's just hard. Accepting that, like having a way to accept that or understand that this is qada, and Allah subhanahu wa ta'ala will compensate not only the child but their families, and understanding that that's a part of life and it can happen to anyone is for you as an oncologist is important. You have to have some way to understand it. You don't have to be religious. I think being a religious Muslim is very helpful in being an oncologist for sure. But then the person in front of you, I don't think there's any catalog that exists in the world that prepares you to hear the word cancer afflicting you or someone you love. Like there's almost nothing prepares you for it, and I don't expect it to be. I don't think people should be walking around preparing themselves for cancer, but there should be a worldview that allows them to accept that maybe that negative things do happen, and there's sometimes nothing we can do about them. What we get trained in a lot is being able to break bad news, is being able to speak to people and allowing them to slowly understand, internalize, accept. It's a process. It's actually a very difficult one to go through. Some people are quicker at accepting it and moving and fighting it and moving on, and some people aren't, and they struggle. And in my experience, unfortunately, and I don't know if this is maybe you guys take this out of the podcast or something, Muslims don't do very well with this. Honestly, my experience, they don't do very well for some reason. I found that that it's really not religion, unfortunately, that's making a difference in how people respond to this news. When I can't fix this for you, because I have to have this conversation almost every day. I go to work every day, someone's going to be, I have to sit them down and say, this is not curable, and the average is 2.5 years. So hopefully we can get you beyond that, but that's all I can hope for. And the person's 46 or 45, they're sitting there like with 6 kids or 5 kids. It's a very hard thing to say. So I find that people, it's really more the maturity they have in understanding life itself, meaning it allows them to kind of deal with this problem rather than, I hate to say this, but I think everyone should think about it for a second. Like for them, you know what I mean?
Yeah, no, absolutely.
Just think about like what would you do if that was said to you? How would you respond? I think if you understand your faith, Islam, this is my qadr, this is my qada, this is the qadr. This is the time He gave me on earth, and whenever He wants me back, I'm ready to go. And I'll just, it's actually, some scholars, or most scholars actually, will say that it's better to know than to leave life really quickly. Mm-hmm. Most people are like, no, I just want to cease to exist. If you believe in the hereafter, if that's a part of your understanding, then no, you don't want to be removed without an alarm being sounded a little bit beforehand, so you can get your affairs in order. And maybe if you're not doing well, you do well, and change the way you live, and maybe make some amends with people around you, or repent or something like that. If you leave altogether, then all of a sudden, then you didn't. Allahu alam, are you doing well? So that's a piece of it. But I also find that maybe to a certain degree, those who are waiting, who aren't living life the way they want to live it, and are waiting for something to happen so they can enjoy life, are the ones who struggle with this the most. Mm.
Yeah. I saw an example of a guy, he's on Instagram.
Yeah.
He's 30 years old.
Yeah.
And he has a cancer. He's basically, call it like live tweeting his entire procedure. He's a Muslim guy. Mm. Complete submission.
Yeah.
Like his mentality is that this is a blessing. Yeah. Alhamdulillah, I've been given an opportunity to think about and to rectify the things that I've had problems with. And I'm going to approach this in a way that is as comfortable as I can for my family.
Exactly. Yeah.
But in a way that I understand that this is from Allah.
Yeah.
And I submit entirely to that.
And that's what's required in order for this to work. Right. If you don't have that mentality, then it's very hard. Like it's a very hard struggle. You end up suffering mentally and psychologically, and people around you do too. And the outcome is the same. Like most of the time, the outcome is the same. Like Shafi'u Allah subhanahu wa ta'ala. We don't provide shifa. I provide treatments, not cures. I provide treatments. The treatments we've been used. Sometimes they work, sometimes they don't. I don't know for sure. I can't swear that they will. Most of these people that we tried it with, they got a certain response. I hope that you get a better one. You're on the bell curve. I hope you're on the right side of the curve and you get even more. But I don't know. And people have to have that. No, this is a part of my life. This is what Allah subhanahu wa ta'ala. This is the hand I was dealt. And there's nothing I could have done. Even if there was something to be done, dwelling on your past is a waste of your time. This is what I have right now. Just deal with it the way it is. Having that mentality helps a lot in dealing with the whole thing. Without that, it becomes a really... I remember there's a guy, he's in late 70s. He was wheeled in on a... he was in like one of those electrical wheelchairs.
Scooters, yeah.
Yeah, scooters. He was on oxygen, like at the time. And he had this new kidney cancer. Now, the guy had like 7 or 8 other heavy medical problems. He was a triple bypass surgery survivor, and he had surgery in his heart. His lungs were not working well. His legs were like basically pipes that were so big and full of fluid. Like he was very sick, and he had this very difficult cancer to treat that we do. And I ever asked him, like, what are you hoping? We have to ask that question. What is your expectation of today, and what we're going to be offering and talking about? And this is what he told me. I'll never forget this. He told me, I haven't lived yet. He said, I haven't lived yet. I want to live. And he's 78 years old. Mm-hmm. And I said, wow. I don't know. Like, I don't know I didn't know how to respond. Like, I actually was kind of held. Like, there are certain responses you're used to. So you have like a way. Again, my job is trying to make it's a difficult journey. My job is trying to make it as tolerable as possible for the patient. Like, if you're going to be stuck with this, then at least have someone who's going to support you and make, cushion every blow and make it easier for you, but also be honest with you so that you're not being lied to. Like, I can't sugarcoat stuff and lie to you and say, you'll be fine, I'll take care of you. And then, which is what we do, by the way, back home. Like, if you go back to the Middle East, we just lie to people about stuff, unfortunately, and don't even tell them they have cancer. I had an uncle who underwent a surgery of like a gastric gastrectomy. They removed his, and they didn't tell him he had cancer until afterwards. And I was fighting with the family to tell. I had to tell him, like, you can't tell him it's an ulcer, we're taking it out. You have to tell him he has cancer. Right. He died 6 months later, but he actually knew, and it was good for him. Like, it was therapeutic for him and for the family to find out. We try to shield people from this difficult news because we think they're going to be depressed and upset. You'll be surprised. Most people will deal with it. Initially, obviously, there's a lot of emotions involved, but and that piece, I think, is what's missing. Is that if you're living life and what you're doing right now is not what life is to you, and you're postponing life, then you're going to be really upset if it happens.
Right.
And if you're living life, and this is what I'm doing. I believe in what I believe in, and I'm doing it right now. Obviously, there are milestones I'm achieving, but I'm living. It's not that I'm just waiting on life to happen to me, which a lot of Muslims do, unfortunately. I don't know why. Like, I've always thought about. I have some assumptions, but I don't. But there's always that we're waiting for, like, especially here's is it okay if I go on a tangent for this?
Yeah, go ahead.
So here's I don't want to talk to it. So here's what I think. I think sometimes Muslims watch other cultures just partying and drugs and alcohol and women, just that life of just that flashy, enjoyable, and they are adhering to their religion and everything. So they feel, because they have a misunderstanding of what they have versus what others are doing, they feel that they're missing out on life. So if they get diagnosed, they're like, I didn't get to do anything and now I'm going to die. which is, in my opinion, the problem is that it's based on your understanding of the law that you follow. Right. This law is not to make you miss out on life. It's there to allow you to live life better, to actually enjoy it more. But if you don't see it that way, then this diagnosis is going to be extra devastating. It's going to be more difficult because deep down inside, you're like, I want to do that. I don't like this. Mm-hmm. So which is why I tell people, like, it's very difficult as an imam to say these things. But look, you have to live your truth. Like, you have to come to a conclusion of what it is that you stand for and then live it. And if this is a charade to you, then don't waste my time and yours. Like, you're wasting everyone's time. Just go do what you want to do, right? Or to spend enough time to understand why you're doing what you're doing, and then enjoy and embrace it. Because Islam is beautiful. If you enjoy it, you're actually happier than anyone else on the planet if you fully engage in it. And then if life ends early, you don't feel like you missed out on anything. Yeah, that makes sense. Like that,
right? Yeah.
Because I've dealt with people who don't believe in anything, like have no belief in a hereafter at all. And they deal with the cancer diagnosis way better, right? Because they've always lived the way they thought they were going to live. Like, I'm not, and that's aside from like the akhirah piece. It's just on a psychological level, people should be living how they believe life should be lived. So that whenever they run into a musibah, whether it's cancer or something else, like, it's not just cancer that ends life. There's a lot of other stuff that can end life. Tragedies that come from outside, or environmental disasters can occur. Like, anything can occur. Right. So if you're not living well, then when it ends quickly, or you're stuck with a problem, then you're extra upset. You're more than you would be if you were living well.
Right.
If that makes sense. Yeah.
That makes sense. And I think the psychological impact of the psychological, perspective of the patient translates to the loved ones in the family quite a bit as well.
Oh, for sure.
We recently lost someone very close to us. As someone who's like an uncle to me, and the father of one of my close friends. Yeah. And the way that he handled it passed on to his sons and his family in a way that they were a lot more comfortable with even the process of going through everything.
For sure.
And I don't think that if he had handled it in that way, it would have made it as easy for the family. And it's already incredibly difficult.
You project your, as someone who's struggling with it, you project your emotions and your values on the people who love you when they watch, because they can't do anything about it. Like, sit there and watch, right?
And so for those family members, what can they do to support, a sick family member?
Very good. That piece is really important. In oncology, there's a rule that patients with stronger social networks do better. They even live longer.
So it has an impact from a psychological perspective.
Yeah, for sure. Patients who have a stronger family network around them, people who support them, people who help, they do better with treatments. They live longer on average. If you're psychologically sound, I don't know if the word sound is correct here, but if you've found a way to deal with this, you feel comfortable, you feel supported, you feel like you're listened to by your physicians and by your family members, and you're supported by them, then you do better. So really, if you're in a position where someone you love has cancer, your job is just to be there for them. There's an urge to try and teach or tell them what to do or tell them how to feel or tell them how to respond. Really, as a loved one, that's not your role. Your role is just to be there for them. Just support. Whatever that support, whatever they need. Like, if they need someone to complain to, let them complain. If they need someone to rely on, let them rely on you. Don't carry, you can't carry them. Like, a person can't carry someone else's disease. They can't, be irresponsible towards their treatment plan and towards their problem and make you carry all of it. But you still have to be there for them on the psychological level that they require. And sometimes it's just being strong and being supportive and listening and, being compassionate and being empathetic, and there's really nothing else that you can do. And, not letting your emotions, again, not projecting your emotions as a loved one on them. A lot of times that happens where you're so sad that you make them feel worse. They don't need that. They're already dealing with the pain and the fear and it's an end of life type of thing, especially if it's, more, or sometimes it's not. It's just like a new diagnosis. And then if they're more scared than you are, how are you going to deal with it? You're stuck with this, and then now I know a lot of guys and girls, ladies and men, who get diagnosed and don't tell their family for months upon months, for months on end. They won't tell their family. They deal with this alone.
What are they worried about?
Because they know that they tell their family, the family's going to lose their minds. If everyone's going to start screaming and crying and calling everyone, people are going to be depressed. They're going to get a million messages on their phone with people who want to know details, and guys who are here, try this, this herb that I found that the sheikh on the TV talks about, and then it becomes like this barrage of just suggestions, and that's not what a person needs. A person needs support. And they need their people around them to be strong and to be there for them in a way that they allows them to internally deal with this problem that they have. And unfortunately, a lot of our families aren't very good at that. And that's a problem. I think that people, if you it may not be fair to ask people to imagine if you were diagnosed, but imagine if someone you loved was. I think that's a reasonable thing. Not anyone specific, but imagine if you had to be dealing with a loved one who had it. Make sure you have like the right understanding of it. You have to be strong for them, for their own sake, so that you can your weakness will project on them, and your strength will also. Yeah, it's something that it's infectious. Whatever you project, people will pick up on. And it goes both ways. Like you said, the gentleman who passed away, because he was strong, they were able to be strong. If he wasn't, then they probably would have struggled or wouldn't know what to do.
Right. Yeah. Do you think part of the reason why we struggle with supporting people is we've lost a little bit of that sunnah of visiting people when they're sick as a regular thing to do? Like we're out of practice?
Yeah, it is out of practice. I do a lot of it just because this is my discipline. So anyone who has cancer in the community, they'll reach out, and then I'll go and I'll spend time. I was just with a gentleman who has end-stage liver cancer. He's very young. He's very young. He has 6 kids. He's very, very young, and he won't. Allahu alam, he won't be around for very long. I take my son Ahmed with me. Just sit and listen and kind of watch. Life is hard. We're very pampered now as a human, as a race. We live in bubbles because we see everything, and we see glamorous lifestyles, and so the expectations are wrong, much higher than they ever were before, and any glitch in them becomes very causes a lot of stress and pain, and people don't know how to deal with it. And yeah, for sure, if we practice more of iyadat al-marid, of just going and visiting and knowing how to do it. The problem is, like, we don't know how to do it. Even those who do it, they go and they get emotional themselves, and they make it harder for the person, and they stay for like an hour, and the guy is tired. Like 5 minutes, 10 minutes, make dua for them, bring a gift, be encouraging, and then leave. They just need that little positivity in their life, here and there, and that understanding that people still care, that they're remembered, that they're not, because they're sick, forgotten, and those people have moved on while they're still alive. That feels really bad. Like people are going to move on when you pass away. That's for sure. There's no way around that. We do that all the time. Like the reason that you and I are sitting here is because we moved on from people that lost their lives in our life. But people shouldn't feel that others have moved on from their existence while they're still here. So that Iyat al-Marid is really nice. And there used to be a group here in London who did it.
They would just go visit people.
Yeah, there used to be a group of older brothers. I think Brother Ashraf Ghani used to do this. He used to take people and go to the hospitals just to visit people who were ill. Not specifically if they had cancer, but just people who are ill for whatever for whatever reason. But for sure, if they have like a terminal illness, they benefit from it. Yeah, for sure.
Right. Yeah. I think that's something that we have to get back to. I mean, even if you go back to that concept of being a caretaker and thinking about others and going to visit them and, like 100%. You said, lift their spirits a little bit. And it's something that we have to get back into the practice of doing
in your capacity. If you're not a physician, so you can't actually bring treatments, then what can you do? So caregiving is just the concept of, what I care for this person. I want to do my part in helping them. So what is that? So just make sure you play within your lane. Just stay within your lane. Just play, within the limits of what you can do. If you're not a physician, don't come to this poor person and start talking about every single myth that you've heard and what can help. Because now you're giving them all this false hope, and you're getting them all worked up on stuff, and you're making them stay within your lane. What is your role here? And then do that. If you're a friend, just be a friend. Be a good friend. Take something off their hands if they're worried about it, that you can take off their hands. For example, if you're good at something, whatever it is that you do, and they have an aspect of their lives within that discipline or that field that they're worried about, do that. Take that for them. And that's really what we owe one another. And it's pay it forward, really. Right. Or sometimes even payback, but it's paying it forward, because you will be in a position, not necessarily cancer, but you'll be in a position where you need people to do that for you, and you'll want it for sure.
I've seen something that's really nice that I like is people that may be busy or far away. If something occurs to one of your friends that lives a couple of hours away, is just sending like an Uber Eats to their house, or sending them meals or something, like just so you can maintain that. That connection, even when you don't have the time to necessarily go in person, but at least a phone call and
gifts. So just a gift, send a gift, flowers, anything that we like to know that people care, that we're remembered, and that we matter. Right? That's very valuable, and any gesture that shows that, regardless of what it is goes a long way with people. It really does. SubhanAllah. Like I always, it's funny when we walk into you ask patients. They do patient surveys and ask people like what they liked about coming for example, working with this doctor or that doctor, and they'll say stuff like, the reason I like this doctor was just because every time he walked into the room, he asked me about my son. Like he remembered that I had a son that I was proud of, and he always asked me, well, what is he doing now? Where is he now? Just seeing them as a person rather than a disease. You're a person. Yeah, you have a disease, but you're still a person. You still have all these hopes and dreams, and you're still very complex. You're not just your disease. You're not just a patient. You're a human being, and you want to be seen as such in life. So every time someone visits you, they're all depressed and upset because because you have a disease. You're no longer a human to them. Like you feel like, oh, I'm just the disease. I'm just the illness. Sometimes they want someone to come over and just do something fun. Like just take me back to being a person for a minute. Can we just do that for a second? Do we have to talk about this? Because marda don't like people, like if they get 7 visits a day, for example, 5 minutes each, but the whole visit is just talking about the cancer, asking, okay, so now what are you on? And what's the doctor saying next? So they have to relive it's like 7 times a day. Of course they're going to be upset. But if you come in and I'm not saying ignore that they have it, but just make them feel more human, and it's meaningful for them to. So that's a big piece as well. Sometimes friends just go in and just joke around with them a bit and just let them feel that you're still the man.
Right.
You're still my bro. Like we'll still chat about stuff. Sometimes they need that. And it's being sensitive. That social IQ that allows you to know where are they right now in terms of their mentality. Yeah.
Right. I want to ask you with Ramadan.
What a depressing podcast you're running with me here. Talking about cancer is never fun. There's nothing good about talking about it. People ask me why I do this. My family members, it's just a lot of cancer in my family. There's a lot of cancer in my family, way more than probably other families have. And we don't really have any mutations in our family. I think they probably spilled something in our area, like close to, because we live close to Mount Hermon, Haramoun. It's right at the triangle of Lebanon, Palestine, and Syria. So something was spilled in that mountain because we're farmers. People eat from the ground, and it's like everyone has. I didn't even know death was possible outside of cancer until I was like 18. Like because everyone just died from some type of either leukemia or some other cancer, and it became obvious that we had a problem in our not just in our family but in our area. So we became interested in kind of looking into it more. But it's definitely not an uplifting topic.
Not a fun topic.
No, not at all.
It's all right. So Ramadan is 3 weeks away, as insane as that is to think about. And by the time we put this out, it'll probably be about 2 weeks away. Allahumma ballighna Ramadan. I've been seeing a lot of these things online that I want to ask you about as it relates to cancer prevention or treatment and fasting.
Sure.
So these like online fitness experts are doing these 72-hour water fasts and all this kind of thing. So I was wondering if you've come across any research that you think is actually...
So we don't have any evidence that these things prevent cancer. But what we do know is that fasting is very healthy to the human body. Like the less you eat, the healthier you are, as long as you're giving your body enough nutrients, like the amount of nutrients that it requires to survive. Anything beyond that is actually not helpful to the human body. Like the fat pads that we carry, that my 1 pack that I have here is not a healthy thing to have. Like it's not good for you by any means. Eating less, we know for sure, is healthier, and that goes across the board. It's not specifically for cancer, but the idea of sugar causes cancer and sugar, we don't have evidence. Now, could it contribute to it? For sure, it can contribute to it, but we don't have evidence that stopping it will eradicate any form of cancer occurring. These fasts that come up on like social media and people, I don't know. I don't have evidence to support that that's good. But fasting in general, like Ramadan in general, if it is practiced appropriately, where you actually eat less throughout the month, then it is healthy, and it's for sure healthy from a cancer prevention perspective. There's benefit there. How I can't quantify that for you or tell you what it looks like, but we don't do that, unfortunately. We just overeat at night. That's kind of what Ramadan has turned into, where you don't eat during the day and then you just unleash after Maghrib until Fajr, and that has to change. You actually have to, your stomach, if you do Ramadan appropriately or correctly, your stomach shrinks. Hunger is based on how big the pouch is. It's how big the empty pouch is. So the bigger the emptiness inside, the hungrier you feel. So people who are really big feel hungrier. They actually do. Like if a person who is standing there, they're petite and small and they don't eat very often, they're hungry. But the overweight person who hasn't eaten, they feel hungrier because their pouch is bigger. That's why they do the gastric bypass surgery. They make the pouch smaller, so they feel less hunger. But then it's of course a psychological habit to get rid of stress through eating. So you make your pouch bigger again, and then you go back to the same problem. So if you eat in Ramadan appropriately, like you actually fast well and you don't overeat at night, your stomach over Ramadan will get smaller and smaller, and you'll actually be able to survive on less food throughout the day afterwards. Like even if you don't fast after Ramadan immediately, but you can survive on less food. Now you don't want to, but you can. Like you feel less hungry. The Prophet ﷺ in the Sahaba, if you read these stories, they would take rocks and they would tie them to their stomach. Why? Because when you tie a rock to your stomach, it squishes the stomach, the gastrum, the stomach. So the emptiness there's no emptiness anymore. Like you're sticking the two pieces together, so you don't feel as hungry. So it actually works. Biologically, it does work.
I've seen people doing this in Gaza.
Yeah, they do it now. Especially in the north. Especially in the north, people are there's people actually starving. Like people don't have access to wheat or barley or sometimes even fresh water. I don't think the south is that different, but for sure in the north there's a lack of basic resources, and that's just. I mean, that's a whole. I don't think this podcast is for that, but for sure it's devastating to think that there are people who are living in probably the richest area on earth in terms of resources when it comes to water and land and food, and they're surrounded by people who are on every side that have more than enough, and we just can't get it to them so they can eat. It's just devastating. But yeah, it does work, unfortunately. Yeah.
And the fasting on Mondays and Thursdays, I guess, is
it's
regularly through it to Sunnah.
Yeah, it's very helpful. Yeah,
healthy.
Oh yeah, very healthy. Fasting, but appropriately, like fasting where you don't. What's the point if you fast for 17 hours and then you go and you eat more than you would have over the course of the 24 hours that you were in? We don't have evidence that it's better. So some fitness experts will say no, it's fine because and then they make something up about the body's metabolism and stuff. I don't know if it's true. Like I don't have evidence that that's true. But if you do lessen, the Prophet ﷺ taught us, "Ma mala ibnu Adama wi'a'an sharran min batnihi," meaning you'll never fill up a vessel in your life that's more detrimental and evil to you than your own stomach. The worst thing you'll fill in your life is your stomach. Like you'll fill other stuff. This is the worst thing to fill up. So if you have to, then break it down into thirds. Like nothing more than 2/3, where it's the 2/3 are broken down, half food and half liquid, half water, and just water, or milk, for example, something that's helpful. But you do more than that. We don't do that. We Arabs. Oh Allah.
That was something I had to eliminate.
Yeah,
I had to talk to
eat
friends
until we can't breathe anymore, until we fall back like we are, mammoths that we have no. And that's not healthy. That's really what's not healthy, because you're expanding that pouch. When you do it, the pouch was this big, and now when you ate that much, it's a little bit bigger. Nothing that is measurable on a scan, but over 10 years, you'll go from this to this, and now you're a hungrier person. And if at 10 o'clock you haven't had your breakfast, you can't function. You can't think straight. You can't do anything. You can reverse the process, but it's way more difficult when you've gotten into the habit of eating that much. And that's why people struggle the first day of Ramadan. The second day of Ramadan is really hard. That coffee in the morning, that breakfast, that lunch, whatever it is that you're used to. But once you get, by the end of Ramadan, it's not that bothersome anymore. So actually, you don't have to go back to all of your bad habits after Ramadan if you don't want to. And that's what Ramadan is for. I'll say this, maybe it has nothing to do with your podcast, but Ramadan is not, and I teach it in Tazkiyah sessions that I do, Ramadan is not to teach you good habits. Because Ramadan is a large adjustment, right? It rips out your schedule and puts in one that's very different. That type of change is not to help you build good habits. It's there to get rid of bad ones.
Okay.
Good habits are built through small adjustments and baby steps and small changes. Getting rid of bad habits, you need like cold turkey. You need something to be ripped out. So Ramadan comes and it actually gives you the opportunity to get rid of bad habits. So what I ask people to do is in Ramadan, don't just think about the good habits you want to build, which is nice. Think about the bad habits you want to get rid of. Because if once Ramadan is done, you just go back to what you were doing before, then you didn't benefit from the month, because the month allows you to get rid of overeating and overconsumption and stuff like that. And something for sure to think about as the month accelerates in terms.
And as people listen to this 2 weeks away from Ramadan, what can they start doing to prepare for that?
So I would say a journal is helpful, meaning write down what your bad habits are. Like sit down and really think what your bad habits are and be specific. Like be specific and don't tell me, oh, I'm far away from Allah. We're all, what are you doing? Everyone's like that. Give me exactly what it is that you're not doing, that you should be doing, or that you are doing that you don't want to do. Now, the good habits, Ramadan is not going to fix them for you, but it will give you a head start. It's like a booster for you to continue small habits, good habits continue. You can't continue to fast every day and pray all night. It's impossible. Ramadan is just for that. But you can pick up a good habit. Like if you haven't been praying all 5 prayers and it'll help you adjust that. But then look at really the bad stuff. What am I doing that's not helpful to me? And then identify them and then see how Ramadan helps you get rid of if you practice Ramadan appropriately. You don't have time for bad habits. For you to keep a bad habit in Ramadan requires like a lot of work. Like mashallah, I tip my hat. Like if you held on to a bad habit in Ramadan, you really put in the effort to hold on to that habit because Ramadan doesn't allow for it. Like it doesn't give you that flexibility. And so you're actually putting in effort to hold on to a bad habit. But if you practice Ramadan appropriately, you won't have that habit. And then if you've identified that I actually got rid of that in Ramadan, then you can continue consciously to stay away from it after Ramadan, and it'll work for you. So I just tell people to write down a plan for Ramadan, including the good habits, the small steps you want, the boosters that you're going to use in terms of building some good stuff, but also, and separating them. Don't do this, I'll remove this bad habit and put in this good one. No, it doesn't work like that. They work in parallel. They don't work they don't cross lines. Like building good habits is one thing. Getting rid of bad habits is a whole different thing that you're going to do separately. And Ramadan is a really good tool for that.
One thing that I found about Ramadan is it's very uplifting in terms of understanding your own strength and ability. So if you're able to get rid of your most basic necessities of food and water and restrict yourself, then how it should be in theory, once you realize your strength, that I can get rid of these most basic needs, then I can do everything else.
Oh, for sure.
And it's very comforting, and it gives you that confidence boost.
Potential.
You need
tells
to
you
get
that
rid of those.
Your potential is way higher than you think. Right. If you were able to get through a full day of work with nothing, then what you were using before were just extras. So with those extras, you should go farther. Which is why the first day after Ramadan, when you go to work, you feel like, why is everyone complaining? This is an amazing day. I get to have breakfast today. Like I get to eat something throughout the day. You guys, why are you so depressed? Everyone's like I'm pulling their feet in on Monday, and you're like, this is a piece of cake. I did this for 3 days starving. I can know. So it gives you that. But then if you don't consciously take time to notice that and realize it and make some changes, you forget about it, and then until the next Ramadan you don't notice it again. We're creatures of habit, and we just go back to bad habits if we don't consciously watch out for them. How we can now I have more energy, I have more time, and I can utilize it better, and I'm not tired. I can actually focus more on this than because in Ramadan I was trying to, and it was very tiring in my brain. I had to push myself beyond my limits to try and just understand what I was doing and stay focused, and now it's easy. So just do better. The quality of your work should go up, and the quality of the time that you spend should increase for sure.
Right. One of the things I did was before last Ramadan, I wrote down in a journal my ideal day.
Oh, nice.
So I sat down and said, what is my ideal day going to look like in Ramadan? So I want to know what your ideal day looks like.
There's really no idea. The days are pretty much standard.
The best version of yourself.
I mean, it's pretty much, my days in Ramadan are pretty much the same every day. It's Fajr, I wake up for Suhoor, wake up the kids, and then I come for Fajr, and then we give the dars afterwards for like half an hour or so. After that, I go home. Depending on the day, if it's an early day, then I just sit there and do my Quran and tasbih, or if I have some work, I finish my work, and then go to work, spend the day there. I come back if I'm lucky, I get back home around 4:30 or 5. If I'm unlucky, a little bit later. But if I get home a little bit reasonable, I come home and I lie down for like a half an hour, just maybe fall asleep after also just for a little bit. And then I wake up and spend time with the kids. We have our futur. I come after futur, I have my futur, we pray Maghrib, we have futur, and then maybe I only eat dates and water and have some soup. Sometimes, if I'm lucky, I break the habit every once in a while, but usually that's all I do for futur. And then I have to come here because I have a dars like 40 minutes before Isha, so I have to be here early to set things up. I give the dars, we do our tarawih. I finish tarawih, and then I go home, I have leftovers. It's actually a really good thing to try. Like no one does it. See, everyone's all about toughness, but no one, I dare you. So here, I'll give you a dare. Yeah. In Ramadan, when at futur, only have water, dates, and a little bit of soup. Don't eat. Your wife made amazing food. Just don't eat.
What
See if you can do it.
happens? What's going to happen?
What's going to happen is you're going to learn something about yourself. You're going to learn that you are fasting just because for the promise of food. And that's not a healthy way to fast. Fast not for the promise of food. And when you do it and you find it's no big deal, that I can come after tarawih and have leftovers and then go to sleep because you can't eat as much, that you start fasting throughout the day, not necessarily focused on Maghrib Adhan. Like Maghrib Adhan is not your salvation. Like it's just, now I'll get some water in, and it's healthier for you in terms of the fasting itself. You'll eat less, and it changes your mentality towards fasting altogether. I give this as a task for students every year. Maybe one or two of them try it for a couple of days and then they cave. Most people can't do it. But once you do it, it makes a big difference in how you view fasting. You pray better at night because you're not full. If you come here and you have a full stomach, you're standing there, you're almost intoxicated. Like you can't even, you're not listening to the Quran. You can't wait for the imam to be done. Your burp is a public health hazard every time. like it's not a healthy way of doing. But if you actually do it differently and you eat very little, you come here, you're actually still very much energetic. You're able to enjoy the prayer, you enjoy the night, and then you go have something. And you eat less because at night you don't eat as much, and you want to go to sleep. Because I have to go eat and then immediately crash. Like I have to sleep because I only have a couple of hours to get up again. And that's my day, every day. And then at the end of the last 10 nights, obviously, it becomes much more difficult because of tahajjud. And I usually give like a after Asr dars, like a lecture at the last 10 nights. So it becomes a little bit more taxing, and but I usually take some time off, so I steal an hour here and an hour there, like throughout the. If I'm lucky, I go home after Fajr, and if my day starts a little bit late, like it's 9:30 or something, I get like an hour.
Right.
I slip an hour of sleep in there, and then get up and go to work. But it's just like a little bit of you're on it's like a marathon. Like you're running a marathon. You're just keeping yourself above water. Just focused. You have no time. There's really no time for leisure. Like weekdays are all the same to me. Like weekends are just helpful. But I go home. I don't have to go to work. So I get to sleep. I get to go home and get a good night's sleep. Then wake up and it's just doing. You want to keep it. You do as much Quran as possible throughout Ramadan. You want to do as many tasbihat and adhkar. You want to do a lot of knowledge seeking. I try to use the time that I have doing that. And then of course you still have your family to take care of. So time management in Ramadan is much more difficult because it's just you don't have as much time to actually give, and you're much more tired than you are outside of it. So I don't know if it's an ideal day, but it's I love it. I find it very. I look forward to Ramadan. I always look forward to Ramadan. It's my favorite part of the year. People who know me from years ago, I always push like Ramadan is make it the best. This is going to be your best time of your life. You'll love it. It's tiring a little bit, but you'll look back at it and say that was good and it helped you out and it made you a better person and strengthened you and gave you something that you didn't have before. And it's like your batteries. It's like your battery's like at that, that you read time where it's just like your battery's empty, and he said Ramadan comes and catches you just before it kind of you die off, and it fills you up again, and you feel all energized after Ramadan, and you can go hopefully get you through the year, inshallah, because you feel the farthest away from Allah you feel is actually just before Ramadan, because it's just that lack of good habits, sets in.
This Ramadan in particular, I think, is going to be very needed for people.
Oh, for sure. Yeah.
I think people have been through very difficult past 4 months or so.
Yeah, it's been 130 days or more.
In a lot of cases, it's been beneficial for some people in the sense that it's forced them to put things in perspective and to turn back to the things that they should be doing and they know that they should be doing. And this may be the first Ramadan for a lot of people that they feel really engaged and they feel...
Inshallah.
So I'm looking forward to this Ramadan from that perspective as an uplifting thing for people. I am a little worried that the focus will become on rituals and turn slightly away from the social justice piece and from striving. I think,
in my opinion, it's very much connected. I think this Ramadan, at least the motto that I'm going to put out for this Ramadan is this is your chance to change. This is your chance to turn things around for yourself. If you have not come to the conclusion that it's worth doing at this point, then I don't think anything will. And if you're the last 130 days I put things into perspective for you, and you feel like life should be lived differently and we should be different people, and you want to make that change, well, here you go. Here's your opportunity to make that change. If you've wanted to make it all your life, Ramadan is there. So I don't think it's wrong to fully embrace in the rituals and strengthen your connection with Allah and learn about yourself and learn about your purpose and what you're here to do, and get rid of those bad habits and start building new ones for the sake of being a better Muslim, so you can be a better person for the causes that we need to be better for, which I think is... So I think actually, inshallah, it's obviously, it's not to capitalize on anyone's pain, but sometimes these things happen, and we have to make the best of them. Like we have to take the benefit from what occurred. What occurred was a wake-up call for the ummah in general. We had gotten into a little bit of a, I don't know, kind of plateaued, a little bit of a slum. We just got used to things. Everyone was just kind of focused on themselves, on their building their homes and furthering their careers, and then this came and happened and reminded us that's not how life is going to be lived, and that's not what our message is as a nation, as an ummah of the Prophet ﷺ and his teachings. And we have to be better, and we have a good reason to, because when we're not, people suffer and people die. If we were better, if we were a stronger, more functional ummah, this wouldn't have happened. Like they wouldn't have dared do all this. Like the international silence that we're witnessing, and this international acceptance of just killing of Palestinian people, children and women and elderly, and bombing of hospitals, and just this ongoing brutality that they're showing, this small strip that's smaller than London. Is because we have no voice and because we have no strength, and that strength is accumulative, meaning the strength of the ummah is the sum of the strength of the individuals that make up that ummah, that compromise, that make up the ummah. And if you want to see a change in this status, then we have to start by taking a long look at ourselves and deciding, okay, how am I going to be different? How am I going to live my life? And Ramadan is the only time that I'm aware of within the year that grants you that ability to turn things around and make a full repentance and just jumpstart your life in a different direction. So that's what I think the motto should be. I think that should be the mentality that, okay, I can't afford to be like this anymore. I have to change, and now is the time. Ramadan, here it is. Change, ya akhi, change. You can be better. You know you can. Why? You owe it to yourself. You owe it to the people. They're us. They're not like us. They are us. Look at them. They look the same as our children. They speak the same language as the same deen. All human beings are. Like, I don't even look at this as it's just. But I mean, you have a bigger reason. You have more affinity to this problem, because there's the similarities. There's so much in common, so you can't ignore it. Yani sometimes, I'm not saying you should. Honestly, human beings should feel for all living things. That's what Caregivers is about, right? Like, to care for everything. But when you have a stronger reason to care for a specific group or a specific problem, then it's very hard to accept or to rationalize why you wouldn't. And if people are struggling with their affinity or their adherence or their lifestyles or the closeness to Allah and the closeness to their deen and closeness to this social justice problem, then Ramadan is their opportunity to turn the ship around and make a difference, which is, I'm hoping, what we push Ramadan, inshallah, to be.
I think that's a perfect place to close.
Yes, inshallah. Thank you for having me. Well, this is very nice.
This is an open invitation. Anytime you feel like you want to talk about anything.
You don't want me doing this. I never know how to shut up.
You're welcome back, of course, at any time. Jazakallah khair.
I really appreciate it. This is very nice, and may Allah grant this initiative barakah, and may there be benefit, inshallah, for people. And I hope to listen to you, inshallah, do this for years to come with individuals who are much more interesting than me and have better things to say. Inshallah, we can all benefit as a community, inshallah.
Thank you.